That's some pretty sobering information about our children, so thank you for bringing that forward. And I also thank all of you for joining us for this virtual media briefing today. My name is Sharon Pappas, and I have the privilege of serving as the Chief Nurse Executive for Emory Healthcare. I also had the opportunity to present to the community when our respective healthcare systems came together to address the COVID-19 surge and the importance of vaccinations in August of 2021, almost 5 months ago to the day. Unfortunately, today, I'm sharing a similar message, one that I cannot stress enough. As we mark nearly 2 years of the COVID-19 pandemic and the fifth surge, hospitals continue to remain overwhelmed with patients in the metro Atlanta area. At Emory, we are seeing not only a high volume of COVID-19 patients who are unvaccinated, but also a number of other patients who are coming in for many types of care, surgeries or emergencies. And some of these patients may also test positive for COVID and need additional care for that. Like other hospitals throughout metro Atlanta and around the state, emergency departments remain busy for urgent and non-urgent situations, and wait times can be long. While our health systems have best practices in place to provide high quality patient care and manage capacities at our health systems are stressed, and our healthcare teams are stretched. When I talk with our nursing team here at Emory, and I walk the hallways of our hospitals and clinics, I witness incredible courage, creativity, and just excellent care being provided to our patients. I also hear the frustration in our nurses' voices, and I see it in their faces. Frustration when they cannot provide the critical care to patients that they need in order to meet the patient's every need. I hear and see frustration when our care team members have to restrict visitors and deny access to the patient's loved ones due to the increased COVID protocols. I hear and see the frustration when our care team members face anger and verbal criticism from those we provide care to. While we understand that everyone is stressed by the extra restrictions and increased wait times due to the pandemic, it is still difficult to be on the receiving end of that behavior. I see and hear a mix of frustration and compassion when our care team members have to work extra shifts when they're tired because other care team members have fallen ill with COVID themselves. As I referenced in August, staffing shortages throughout healthcare remain a concern. We are seeing many nurses and clinicians leave the profession or pause their careers because of the stress the pandemic has caused both personally and professionally. Decreases in staffing directly correlate to our ability to provide access to care for the many patients and families who depend on us daily. Our hospitals are doing all we can to bring in additional staff everywhere we need it. We need everyone to do their part in the fight against COVID-19 and keep critical health services available to those who need it most. To keep emergency departments available to individuals who have the most critical health needs, individuals should obtain care at the most appropriate medical facility for their condition and seek COVID-19 testing at primary care locations, public health, and mass testing sites, or use in-home testing kits. Please remember that emergency departments are for those seeking examination and treatment for medical emergencies, not for routine COVID testing or even mild symptoms. Use at-the-home testing kits, public health testing locations, or independent testing facilities if you need to be tested for COVID-19. That is, unless you're ill and need medical care. For routine COVID-19 tests, you can find a location near you on the Georgia Department of Public Health website, or go online to order free at-home testing kits at USPS.com. Please also anticipate increased wait times for medical services. Due to the influx of patients and increased demands placed on our healthcare workforce, we ask everyone who enters our facilities to practice patience and kindness with each other and with our care team members who are providing expert compassionate care. Thank you for your time today. Emory Healthcare's top priority, like all of my colleagues here, is to provide safe, quality care and treatment to all of our patients. We're grateful to our many care teams and clinicians who continue to stand strong and fight this battle with strength, determination, and grace. Again, thank you for being here. And now I'll turn it over to Dr. Morgan.